This is a story that all employers know all too well. The costs of healthcare for your employees are on your shoulders, and that cost is rising every year. Decision makers across the country in a recent survey shared that the cost of healthcare is a major barrier to achieving their business goals. A full 82% of you said this is the number one issue. The cost of healthcare in the United States is going up dramatically, but you already know that. It's $2.91 trillion. Not only has the per capita cost gone up dramatically over the last 20 years, but so has the share of the GDP. That's 20% of the gross domestic product by 2015. Where's the money go? Well, 84% of healthcare spending simply pays for the healthcare costs of patients with chronic illnesses. A full 50% of all U.S. residents, including employees, have one or more chronic illness. The definition of medication adherence is simply taking the medication your doctor's prescribed for you, going to the pharmacy and getting it filled, and then taking it on time and in the correct amounts. Anything other than this is referred to as non-adherence. That's the problem we need to fix. 70% of all Americans take prescription drugs, but 75% of those don't take their medications as prescribed by their doctor. And an astonishing one-third of all these people never filled their prescriptions at all. The U.S. wastes more than $317 billion each year treating unnecessary medical complications that could have been avoided if patients had just taken their medications as prescribed. Medication non-adherence is the costliest health condition we face. In fact, curing non-adherence would cover the healthcare costs of 44 million Americans. Better adherence leads to improved healthcare outcomes and decreased healthcare spending. In fact, the average savings for adherent patients with chronic illnesses can total in the thousands of dollars per year. A patient with congestive heart failure, that is adherent to meds, has almost $8,000 in lower healthcare costs. And patients who are non-adherents are estimated to have an additional $2,000 per year in unnecessary doctor's visits. Non-adherence contributes significantly to 20 million lost workdays annually in the United States. Along with this dramatic absenteeism is reduced job performance. People don't take their medications because they might have some questions or concerns about the meds. They might have some financial considerations. But the overwhelming 69% is due just to forgetfulness and procrastination. These folks simply need a reminder. People who don't take their meds as prescribed cost us all more. Taking your meds on time matters when it comes to controlling healthcare costs. According to ADP research, 70% of employers are looking at wellness programs to control healthcare costs. When employers offer a medication adherence program, the company realizes greater productivity gains, decreased healthcare spending, and achieves a healthier, happier staff. We make it easy. MedTexter reminds you and your employees to take your medications on time, every time. MedTexter will help you manage your meds. You'll get alerts when it's time to take your meds and when it's time to refill your prescriptions. The system works on your smartphone, tablet, or computer. It works worldwide, and it's secure, protecting your personal information. Take control of your healthcare costs. MedTexter will keep an eye on your employees' meds, help to increase your company's productivity, and lower your healthcare costs all at the same time. It's easy. MedTexter reminds you to take your meds on time, every time, because taking your meds on time really does matter.